For people with developmental disabilities, this means that their hardworking staff will finally be rewarded. They will receive some extra payments that can help make their lives a little easier. And hopefully they will feel encouraged to keep working on behalf of the people that they support. For families, these payments will mean greater stability for their loved ones, less staff disruption, and the knowledge that people who know and care for their loved ones will be there to support them. And for our provider community, this means that they can finally provide some well-deserved financial support directly to their DSPs. We are excited to be able to use these one-time funds to make such an important investment in the workforce, a workforce that has done heroes work throughout the pandemic for the people that we support, and a workforce that continues to show up to do their best under challenging circumstances. We're also hoping to mirror these investments in the direct workforce who provide services in ICFs, day treatment, and other non-waiver services. OPWDD is pursuing an emergency state plan authorization to replicate these workforce payments for state plan services. We will keep you updated as that proceeds. I want to acknowledge that although these one-time investments are great strides in the right direction, we understand that long-term solutions will be needed, and we will continue to advocate for permanent wage increases for direct support professionals through the annual budget process that's coming up soon. And while we want to move as quickly as we can to get these payments in the hands of staff, doing so will require the very important process of obtaining information and issuing the appropriate funds for the various bonuses and incentives to each provider. And for that, we will need the help of our provider community. We understand the need for speed, but we also must ensure that federal rules are followed and that we disperse this money appropriately and that it's done responsibly. Today's introductory webinar will provide an overview of the program for our provider community and for others on the call about how providers can help us to get these payments processed quickly. A technical assistance webinar has been scheduled for providers to learn more details and to begin the process for participation in this critical program. With their help, we anticipate the funds will be out the door in early 2022. I hope you find today's webinar informative and that together we can begin the process of making the awaited payments a reality as soon as possible. Before I hand it over to Kevin to walk you through the details, I also want to take a minute to acknowledge the incredibly hard work that went into securing this approval. The team here at OPWDD, Roger, Kate, Kevin, Allison, put many hours into making this investment a real thing for New York. And thank you to Jen and our communications team who have worked so hard to make sure our stakeholders know what's going on. Without their hard work, we wouldn't be here today talking about this exciting opportunity. Thanks for being here, and we look forward to working with you. Kevin, turn it over to you.
All right, can everyone hear me okay? Yep, okay, thank you. I lost my earbuds here, so I'm flying speaker and mic. So again, I want to, thank you, Commissioner. Thank you for your opening remarks. This has definitely been a very intense effort to try to secure this funding and use it in the plan that we set forth and proposed to the federal government back in July. So with that said, I don't want to spend a lot of time. This slide is really kind of a high level overview. The Commissioner recapped, everything here in her opening statements. I think the key takeaway here is that we're getting a 10% enhanced federal share on HCBS services that is producing general fund savings, and that general fund savings is really what the subject is of of the reinvestment plan, right? So when we talk about the state funds equivalent, or you hear all those types of buzzwords, really what that's representing is how we're reusing the benefit we're realizing because of that 10% temporary bump in the federal participation of HCBS services. So as the Commissioner indicated, right, in November, there was full and final approval of the OPWD's Appendix K application, and we did actually, I'm sorry, I have two flies flying around here. So we have, we did make a subsequent amendment to the Appendix K to change one of the payroll dates that we'll talk about in a few minutes. But really that final approval allows us to begin the final processes necessary to implement these investments. And so just to recap, and this is really what we want to talk about today, are the supplemental workforce payments that we've identified through the EFMAP plan and ARPA plan interchangeably. So the first is a COVID-19 service payment. When you've heard me talk before, I referred to that as the HEROES Fund. The second is a COVID-19 vaccination incentive payment, VIP. I'll probably refer to it as we talk through a little bit. And the third is really a 3A and a 3B, right? There are really two bonus payments that we're looking to make. One is a longevity, which I would just kind of, simply keep as a retroactive look and an adjustment for activities during the pandemic, the onset of the pandemic. And then a retention bonus, which is kind of prospective in nature, really to cover the current fiscal year we're in. I just want to kind of acknowledge too that the 10% enhanced benefit only applies to claims paid, Medicaid claims paid for HCBS services between 4/1/21 and March 31st, 2022. So it's definitely a time-limited benefit here. Next slide. So based on a lot of the stakeholder feedback that we received, we've really focused in, and I think that came across in our draft EFMAP plan that, again, was ultimately approved by the federal government, is that we're really focusing on direct support professionals, direct care staff. Those are really those staff that are defined in the provider CFR as Title Code 200 series. I think the operative title that we use is residence worker, but we're looking at the gambit of the 200 series staff and defining them as the direct care focus. And this has been consistent with some of the prior state legislatively mandated targeted compensation increases from 2015, 2018, and 2020. So just think of it from that perspective in terms of who's eligible for these incentives. And really what we're looking at payments across really three different types of programs. So all the direct care staff, again, Title Code 200, who deliver agency-sponsored HCBS services, right? So they're directly employed by a voluntary operated nonprofit. We're also extending the benefit to staff who are self-hired or that support people who self-direct through the self-hiring process, so not affiliated with an agency. Really, I think the employer of record is the fiscal intermediary. And then the final cohort are family care providers, right? And we're saying regardless of hospice. So if the sponsoring billing agency is the state of New York, we're looking to extend payments to those family care providers. And if it's one of the nonprofits on the call as the sponsor, again, we would expect that the salary treatments would be paid to their families that deliver the family care service, the ResHab service in their homes. Next slide, please. Okay, so as as I said earlier, there are really three main types of payments, and I want to kind of delve into. Again, this is meant to be a high-level, detailed overview, just to make sure that people understand the types of incentives we're talking about here and what the intent is. As the commissioner indicated, we are working to finalize the scheduling of a technical assistance webinar where Joanne Howard, myself, Allison, Deloitte, and others will be participating to help answer any more directed questions that you may have regarding this initiative or all of these initiatives. So the first of the three that we talked about is the HEROES Fund, right? And really, this is an incentive payment that is designed to recognize direct care staff DSPs who worked during the unprecedented pandemic experience. So what we've done, what's been approved by the federal government, is we proposed and we'll be making payments of $1,000 per full-time DSP and family care provider. The requirement here is that eligible staff must have worked at least a 90-day period, so 3 months during the pandemic, that first during the pandemic, right? And so that what we are looking at, I'm sorry, I'm having a tough time getting my words out today, but it's really for people who direct care staff who were employed on or after March 17th, 2020, and through a payroll period of 9/1/2021 or immediately thereafter. And really what we're trying to do here is really, look at the pandemic period. Yes, it's a little dated, we'll admit that, but we had, submitted this plan a while back and had some, back and forth with the federal government. So, the date is the September 1st, 2021 date. And the critical factor here is to continue to be employed by the provider. And again, we're looking to make that the $1,000 is per full time, and we'll be doing prorated amounts, for employees who work part time in terms of how we calculate the benefit that you will be receiving. This is one of two initiatives that require a survey to be completed by the provider. And so again, as part of the technical assistance webinar, we'll be, talking through that process and the timelines surrounding that process. Because again, we don't know, as you all know, those of you who submit cost reports to us, we don't get a payroll roster. So we can't, we will be relying on your survey results to help identify what these payments will be. Before I continue, before I go into the vaccination incentive program, I want to talk a little bit just about how we're going to pay providers. We're going to be paying you through, a directed payment in essence. And so there is no rate. We're not going to have to claim, eligible individuals with an eligible service with some predefined unit of service. We've worked very, extensively with the health department and are really looking to do kind of a lump sum payment, if you will, to providers. Again, it'll flow through MMIS, eMedNey, leverage a Medicaid share in the first instance, but we'll be working with the health department to promulgate these one-time payments that we'll be posting through the, what is that process called? Through the DOH normal rate setting process. So you'll be receiving information, through your normal rate channels for that information. So again, the goal would be that you get a lump sum Heroes Fund payment based on the survey results that you have submitted to us, right? So it's one comprehensive payment for the HCBS services you render. The COVID vaccine incentive program, similar in scope, in context and construct to the Heroes Pay, we are looking to incentivize direct care staff to get vaccinated from the COVID-19 virus. And so what we're offering here is up to, an amount of $500 to full-time employees who are fully vaccinated against COVID-19. And this is where I kind of alluded to a little bit that we changed the dates here. As originally proposed and requested, the payroll date was going to be 12/1/2021, but because of the delay in getting approval and working through these issues, we've been able to secure federal approval to extend that payroll date to January 14th, 2022. So again, when I put these dates out there, it's the payroll period that ends on or immediately after those dates. Not that date as a drop dead date. And we also, again, this will be another survey driven exercise. Clearly don't have the number of information, the information necessary here to make payments to you. We are, I think that some of this process is really kind of going through that red cap reporting process many of you are aware of from the provider perspective. So this is really kind of an extension of that. Again, survey will be issued. We'll be looking to collect data from you, for staff that meet the criteria as of that pay period that ends on or immediately after January 14th of 2022. Payments will be prorated for staff who are less than full-time and, again, similar in scope and construct. And as I said before, we'll be requiring a payroll survey to be kind of submitted to identify those staff who are otherwise eligible. So now here's where we're going to talk a little bit more about the two bonus payments I mentioned earlier. So just kind of think of this as Workforce Supplement Initiative 3A and 3B. We're looking to make bonus payments available again to the gambit of staff that we talked about. Those who are agency sponsored, agency employed, those who support people through self-direction but were self-hired, and then also family care staff with the family care providers directly. So the first 3A is this longevity bonus. And what, as I mentioned before, this is kind of a retroactive look. We're looking to make, to award a bonus payment to staff who worked between April 1st, 2020 and March 1st, 2021. Again, you'll know, or I should say March 31st, 2021. And that again is the kind of the criterion to determine eligibility. And that the staff member, the direct care staff, has to continue to be employed by the provider agency through that payroll that ended on or immediately after September 1st, 2021. Again, same construct here with the retention bonus, right? This is really the prospective payment. So this is kind of picking up the next fiscal year, the one that we're in right now. Eligible if the employee worked between April 1st, 2021 and March 31st, 2022, and they continue to be employed by the provider for that pay period that ends on or immediately or on or prior to, in this case, March 31st, 2022. So I'll talk a little bit more about the values, I think, in the next slide. So, I'm sure there's a basic question about what does this all mean, right? We talked about specific dollar amounts with the heroes pay and with the vaccine incentive payment. What we're doing here with the retention and the longevity bonuses are a little different. We work to, we want to, instead of going through a payroll survey and trying to wait to determine and get, data back about, current state, what we did is we looked at the 2018, 19, and 2019 CFRs that were submitted and amended, right? I mean, I think many of you providers would be aware that as part of a rate redesign effort, we asked for you all to look at and refresh your 2018, 19, and 19 CFR data. I think we had at least 50 or so agencies that updated that information for us. So we felt that, one, that was pre-pandemic, and two, it was really probably the most rigorously reviewed in terms of accurate data that we have on file. So what we're looking to do is to give out aggregate dollar amounts that reflect 20% of the direct care staff spending that's reported in that base year CFR period. So again, no survey, we're using CFR data to do this. And for all of these payments, though, providers will be expected to submit an attestation so that we're ensuring that funds will be paid in accordance with the heroes pay, the vaccine payment requirements that we've outlined, and then also with the requirements we just discussed the prior slide for the retention and longevity payments, right? And again, I know it seems like it's a lot, but unlike the state legislatively mandated compensation increases that we've done in the past, there's no state law delineating how these funds are expected to be used. So the attestation is that kind of qualifying document to relay expectations of how we'd like to see these monies used to, help with recruitment and retention of direct care staff, ensure vaccination rates, and recognize, the volume of work that people did above and beyond, especially at the onset of the pandemic. So these retention and longevity payments really are kind of arrayed in three ways. I said, we're for those agency staff that are affiliated and employed by HCBS waiver providers, we're taking 20% of that provider's payroll expenditure, if you will, for direct care staff as reported in that base CFR, as I said before. For family care providers, because the families themselves don't submit a cost report, we're going to effectuate a 20% one-time, the equivalent of a 20% increase to that difficulty of care component of the family care reimbursement. And so what, we've looked at billed data. And so what we're going to be looking at is from the period of September 1st, 2020 through August 31st, 2021, we're using the billed data of services delivered. And we're going to be making payments to providers based on the related difficulty of care payment for those individuals. So that's, to just be clear, that's a little bit different. It's not a CFR basis. It's using the difficulty of care payment as a way to acknowledge, a form of payment that goes directly to families. And the third is really, again, bonuses for DSPs who are hired by people who self-direct, their services. So this is, again, a little bit different than just using the CFR data. We're going to base it upon the payment level will be made to the fiscal intermediary, and it'll be based on the approved budgeted wage. So we don't have the capacity to make 20,000 or change rates of payment here, which is the number of people, budgets that we had that we reviewed to calculate these rates. So what we've done is we've effectively used these approved wages on a budget by budget basis and calculated an effective budgeted rate for each fiscal intermediary. Again, we overlaid that effective rate with bill data for the same period, 9/1/20 to 8/31/21, and are in the process of finalizing calculations that would be made to each of the fiscal intermediaries. Next slide, please. Okay, so as I mentioned before, all of these payments initiatives, the three supplemental payments, the HEROES pay, the vaccine incentive payment, and then the bonus payments, longevity and retention, are all applicable to staff, in CFR job position codes of the 200 series, right? 200 to 299. Again, the primary focus are those residence workers. All of these supplemental workforce payments will include a component for mandated fringe benefits, okay? So when I was talking at the last slide about how we're calculating the amounts, with the exception of family care, which is more of a rate adjustment, there will be a mandated fringe benefit component of each of these payments. So think of it as roughly like 11 or 12%, I think is the statewide average. But again, that'll be agency specific based on the CFR. I think we've encountered a couple fiscal intermediaries who have not submitted a CFR for the base period. So we're discussing, what the right and appropriate way, to identify what the mandated fringe percentage will be. So that's a minor issue that we're trying to work through. But I think I can't stress enough, right? We'll have an attestation, we'll have a technical assistance discussion here. But our goal, right, our hopes and desires here with these payments is that, they're going to be used to, support and bolster the direct care workforce. And that's why, the commissioner, in her opening remarks indicated that we will be working to secure approvals necessary to extend these waiver service benefits to other non-waiver programs, right? Primarily ICFs, day treatment. We have a myriad of, state plan authorized day programs for ICF residents. There's some direct care staff reporting clinics, et cetera. So we're working through, that now to, use the disaster SPA capacity to amend the state plan and replicate these payments similarly to staff supporting those programs. It's clear that we don't want to be in a position of bifurcating the workforce. And remember, the federal authorizing statute, ARPA, really did limit the benefit only to HCBS services. And so if you're asking why there's a separate authority for it, it's because of the way the law was enacted at the federal level. So hopefully that brings, some additional clarifications. Again, trying not to delve into the weeds. Let me know as I get down there. So I'll. Allison, I don't know if you. Okay, yeah. So we have a couple things here I should touch on too. One is, attestation, right? We're going to require, as I said before, that providers have to first submit a completed attestation signed by the agency's board president and the CEO. Again, this is because we don't have any direct, state legislative mandate to specify how these funds are to be used, and that attestation document is a way to articulate, hopefully some degree of specificity, but at least directionally what our intent is with the use of these monies. And again, as I said at the tail end of the last slide, right, we expect that these funds would be distributed to, direct support staff and family care providers in accordance with the terms and conditions set forth therein. However, we also require that providers will, adhere to survey results and complete surveys that will go out for the Heroes Pay and the vaccine incentive payment initiatives. We need that survey data to calculate, rates of payment. Without that survey data, we can't make a payment to you. So it's critically important that the attestation is completed and that the surveys are done in a timely manner, so that we can, not delay further, the actual release of these monies through eMedNI. And as the commissioner indicated, and I think I kind of reiterated throughout the document, the presentation, we're looking to conduct a technical assistance webinar as soon as next week to detail these requirements, going forward. So I think that should help the providers, right? That TA webinar is really geared to the providers, the FIs who are going to be in the process of implementing, receiving and then distributing the monies from Medicaid for these purposes. I think we have another slide, Josie. And I really want to reiterate, I think the commissioner, highlighted this earlier too, that these are not going to be like released tomorrow, right? There's a process that we have to follow. We have to work, internally. And so our goal is within, this month to share the attestation that we just talked about, critically important part of the process, for review and signature and immediate return to us. We'll also have the technical assistance webinar, again, tentatively planned, for late next week, to help, address any questions that may come up, right? Because we want to make sure that we get the attestation out to you all so that you're aware of what the requirements are and we can address any specific questions providers will have about how those funds are expected to be used. And then, before the end of the month, we clearly want to also distribute the performance, the Heroes Pay and the vaccine surveys, so that, again, the Heroes Pay one, since it says of a payroll ending on or immediately after 9/1/2021, we'd expect that should be a pretty quick turnaround, right? The quicker we get this data, the quicker we can begin to compile information to work with the health department and other partners in getting Medicaid rates approved. That one should not be a big holdup. Again, the vaccine incentive payment, you'll receive it, but that's going to have to be as of a point in the future, right? January 14th, 2022, or immediately thereafter. So it'll help you to at least understand the level of detail that we're looking at through those two survey assignments. And then, our goal is to really work very extensively on this throughout the first quarter of next calendar year, so the January to March 2022 period. We'd expect that the incentive payment surveys are returned, that we're able to kind of review that survey data with minimal questions, concerns, turn that survey data into rates, and then begin to initiate, while at the same time, begin to initiate the retention and longevity payments. The longevity payments, will come first, right? I think since the retention payments prospective in nature, that may come later in the quarter, but we are working to finalize the calculations, as I mentioned before, of the longevity payments. And so those, the Heroes Pay and the longevity payments should be some of the first two payments providers receive, with the vaccine incentive and the retention bonus payment coming probably, later in the quarter, at that point in time. When I say coming, I mean initiated, right? There may be a Medicaid lag issue here in terms of when the cash is actually received, but our goal is to try to make best use of the enhanced federal funds that are available for Medicaid programs that at this point are set to expire on March 31st, 2022. So that's really why this is really a truncated and aggressive timeline to get these payments out the door. So I think, unless others want to chime in here, I can, take the stab at this, kind of just relaying here that the workforce payments are the primary, right, primary area that we're making a significant investment in using these ARPA benefit funds that we're receiving. However, there's also a component of the EFMAP plan that looks at non-Medicaid services, and really more grants and contracts that also focus on workforce and other areas, right? In developing, identifying innovative day program opportunities, looking to improve, supportive program modeling from the residential side of the world, et cetera. So there are other activities here, and I just want to sensitize you all to that the lion's share are these Medicaid payments, but we will be looking at other contract vehicles to support not only the workforce, but other, system reform opportunities in the short term. Okay, next slide.
Kevin, that concludes the formal presentation. We will take a few moments now to address some of the questions that have come in. We want to thank you for your questions. There are several very good questions for us to prepare and address as we prepare for the technical assistance webinar that both Kevin and the Commissioner referred to. We'll be providing the details of that scheduled webinar in the coming days, either probably early next week. So please stay tuned for that. We will be sharing the recording of this presentation as soon as tomorrow on our website. So there's several questions in the chat asking about whether the PowerPoint or the presentation will be shared. And yes, we will be sharing this recording for you to reference and to review so that you can refine your understanding and, of course, be prepared for any additional questions you may have during the technical assistance webinar. A couple of questions that I think other questions that we might be able to answer today. There's a question about these resources being applicable to state, to employees who are state delivering services to state state-operated individuals. So, Kevin, I don't know if you want to take that one at this time.
Yeah, I mean, at this point, these benefits focused on direct support staff in the nonprofit sector. Where we've got collective bargaining and other issues, from the state workforce perspective that I know, Adrienne and her team are on. And, we're working through some of those. I don't know, Adrienne, if you want to say anything else.
No, I think we're still working through that. I think at another time we could probably talk through that.
And there's another question that requests clarification if these workforce investments apply to CDPAP, which no, they do not. We are addressing HCBS services. And then, as Kevin and the Commissioner had noted, for OPWD state plan services, we are pursuing an emergency amendment to be able to address that in the OPWD state plan services. I don't know if you want to add to that, Kevin.
No, I think that's right. I mean, what we're talking about here are, OPWD HCBS services and, working to secure similar extension, Allison, as you had indicated, to the state plan delivered OPWD supports and services.
And there was another inquiry related to the timing of the attestation that I thought you might be able to address. I think hopefully at the time of the technical assistance webinar, we'll have that in your hands, but Kevin, please feel free to elaborate.
Yeah, I mean, our goal is to get that attestation out, as soon as practicable. We're going to try to give as much time as we can stomach in, excuse me for a second, to try to get that attestation back from you. I mean, I recognize that getting the board resolution, the president of the board to sign it may be difficult. We just ask that folks try to take extraordinary measure to return that in a timely manner, because I will be honest, I mean, that's in essence the application, right? If we don't get that attestation back, there's going to be an inability, I think, for us to pay. So it's critically important to not only the survey, in order for us to move forward and begin to process the longevity payments, that attestation has to be returned, completed, and in hand.
Thanks, Kevin. I think as we review the questions, many are technical in nature. We will be prepared to respond to these very good questions during the technical assistance webinar that's coming up. We want to thank you for your participation and your input. It's very helpful, and we hope this is helpful and encouraging. We are happy to be partnering with you to move forward in the implementation of this extremely important effort and the payments for the supplemental workforce investments. With that, I thank you and have a wonderful evening.